Hi, Jared.
Hey Dan, how you doing?
Um, Doing okay. Some nights I wish I get better sleep, and with all these videos, I'm trying to work on these things. Been walking a lot more. A while back, my dad had recommended walking as a good thing to kind of manage, stress and blood pressure and whatnot. But for brain injury, he doesn't know about that. Needless to say, yeah, just trying to work on myself and trying to sleep better. That's one of my issues.
It's tricky. It's tricky with the brain injury. All the great things in the research may not always apply to somebody with a brain injury. So
Yeah, and
sometimes it's
also,
trial and error
also
too.
you had said it once, little children will keep you up and also wake you up. So that's not conducive to good circadian rhythms. Uh,
That is very true.
but I'm looking forward to this talk. Yeah. All right. Cool. You can share. Great. Thank you everyone for coming. Today's another Building Brain Awareness seminar, and Dr. Jerrod Brown will be presenting on walking intervention, the walking benefits of walking for brain injury. I'm really interested to see what this is all about. So, Jared, take it away, and if anyone has questions, feel free to ask or put in the chat, and I can kind of help manage that.
Dan, thanks for having me back. Good day, everyone. We're
Thank
we're
you.
going to take a deep dive into the topic of walking, something maybe we don't think about enough when we're talking about brain injuries. And what I do want to say, a quick disclaimer. I'm not giving any medical advice today. This is just general education from the literature. Talk to your healthcare provider before using this information because a lot of this information that I'm going to present today is in the general walking literature, and that may not always apply to somebody that has a brain injury. There's a lot of other variables we need to take into account before someone with a brain injury starts walking, because maybe there's mobility issues or blood flow issues, blood sugar dysregulation. So a lot of things you need to consider with your healthcare provider. Here's my email address on the first slide. Reach out if you have any questions. If you haven't heard me present before for Dan's group, here's a little bit about just my professional background. I have a PhD. I have 6 separate master's degrees. A couple of my master's degrees are in clinical neuroscience, applied clinical nutrition. I do a lot of work in the area of criminal justice, forensics, those kind of topics as well. Tons and tons of research I've done, podcast, consultation on a variety of topics related to brain injury.
It looks
How
like
does all this,
you added a master's, an MS
since we
recently.
last talked, I
Okay.
obtained 2 more master's degrees in 2025 in the nutrition one and the applied or clinical neuroscience. So I do a lot of work in
Yeah.
the area of neuroscience, nutrition now. How does exercise fit into this? Well, I actually have a graduate certificate in exercise prescription and phenomenal graduate certificate, learned a ton. And going through that program just developed a greater appreciation for the health benefits of exercise. We all know that exercise is good for us, but it really is medicine. So I decided to take a deep dive into walking literature because most folks can walk. Most people walk. Of course, there's situations where someone may have mobility issues, is in a wheelchair, those kind of things, but the majority of people with a brain injury probably can walk, no problem, or need a little assistance. And there's actually a ton of research literature on the use of walking in terms of being a therapeutic intervention for somebody that's had a brain injury. And I'll point out some of those studies today. So our agenda is pretty straightforward. We're going to talk about walking in general. I think we all know what walking is, but introduce you to some things maybe we haven't thought about. Talk about some clinical considerations. Obviously, we're going to have a focus on brain injury, but I'll point out some things too on walking and mental health, brain health in general. How can we use walking interventions to help people stay sober from drugs and alcohol? We'll talk a little bit about that as well. We'll talk about intake screening and really how do we implement these things into practice? Obviously, you need to have the proper training, credentials. And again, if you're somebody living with a brain injury that is hearing this, talk to your healthcare provider first. This is just, again, information. And then our last section today is just on tips, strategies, solutions, interventions, things of that nature. Type in the chat box if you have any questions at the end of each section. I'll park the brakes, open it up to any thoughts or questions or concerns. So in general, when we think about walking, it really is one component of exercise science. So exercise science is this like big umbrella. A lot of things going on under the umbrella of exercise science. There's many degree programs out there, undergraduate, graduate, and doctorate level programs. There's a lot going on. Some people who get into physical therapy obviously are going to have a lot of training in this. Nutrition, in my nutrition program, we did talk about exercise at various times because I think they really go hand in hand. In my opinion, and I think the research supports this, if you really want to enhance health, you got to eat healthy and exercise simultaneously and get good sleep. So it's not just one. Somebody eats terribly, but exercises frequently, they're still missing the mark in terms of optimizing health outcomes. When you study exercise science, you're going to want to know some of the basics on human anatomy. You'll want to understand how this relates to disease prevention. There's many fields of study that use this. Coaches, wellness educators, folks working in the arena of sports psychology, people that do chiropractic work, even folks that are doing psychology work. There is so many studies that show how exercise really is medicine for folks living with a mental illness. So many, many, many forms of exercise. Walking is one of them. There's all kinds of things. Taking a look at this, if you go through the literature in detail, cooking activities could be a form of exercise, swimming, jogging, doing yard work, and the list goes on and on and on and on. There's good research on all of these topics within the context of improving brain and body health. Now, if you look at this list and you're interested in brain injuries, by no means are all of these going to be appropriate for somebody with a brain injury, especially if we're talking about really high intensity workouts. That might be a little tricky for someone with a brain injury. That might actually just throw off your metabolic activities in your body. And that's just another reason why it's so important for folks living with a brain injury to really consult with their healthcare providers before they start exercising, because there's so many other variables to take into account, including any other comorbidities they may be dealing with, possible nutritional deficiencies, sleep deprivation, the list goes on and on and on. So we all know what walking is, but here's one definition of many that is found in the research literature. And I can send Dan my slides if you want these slides. At the bottom of most of my slides is my full citation. So anytime I give talks on any topic, I try to make sure it's supported with research findings. But here's a good definition. Basically, walking's defined as moving along a surface on foot, step by step, so that one foot is always on the ground, such as when strolling, sauntering, walking forwards, backwards, or sideways. One thing I'll say about this, Dan, maybe you have some thoughts on this. I do know some professionals who are kind of experts in the area of brain injury and neuroscience and neuropsychology, and sometimes part of an assessment is having that client walk front and backwards. And in some cases, that client with a brain injury may have difficulty walking backwards. So it is definitely a variable to take into account. And another reason why people with a brain injury will do quite well having a multidisciplinary team of professionals work with them, including neurologists. So I like this quote here, but walking has been described as a near perfect exercise. It's not, no exercise is going to be perfect, but walking is probably one of the most safest, cost-effective exercises out there. No exercise is going to be 100% safe for the individual, because of a variety of factors, and we'll talk about some of those factors today as well. So if you go through the walking literature, and I've been going through this literature quite a bit in the last year or two, and there's hundreds and hundreds of articles that have been published over the years on walking from various angles. But if you go through the bulk of this literature, what does it say about walking? Well, it says it's easy, it's simple, it's safe, there's low risk of injury. What I will say is that the bulk of these articles don't talk about walking within the context of a brain injury. So in some cases, it may not be safe for that individual. So there's a lot of factors we need to take into account when we consider walking when somebody has some sort of neurological, neurocognitive, brain-based impairment. A lot of other variables to consider here. A little bit more about what the research literature says. Good article that was published last year. So walking's pretty popular. We got lots of walking groups out there. Most communities that are probably mid-size or large size probably have walking clubs you can get involved with. Again, low risk of injury in most cases, not always. It's pretty flexible to implement in most settings. So I live in Minnesota. Gets a little trickier to walk outside in the wintertime. So we got to think about fall risk, mobility issues. But there's plenty of walking tracks in Minnesota too that people can take advantage of in the wintertime. We got to consider too air pollution. Maybe you live in a big, big city and walking outside may not be good for somebody that has asthma or breathing problems. So definitely something to consider. And typically walking, there's no equipment involved, so it's very cost effective. We all know the benefits of walking, just breaking it down. We'll talk about many, many today. So regular walking, you're in better physical fitness shape. Your brain's probably working better. Routine walking is a really good way of reducing future disease risk. Obviously, there's a lot of other factors there too, what people eat, their stress levels, their sleep habits, their gut health, all of those things. And plenty of research literature does show that the engagement in regular walking can reduce the risk of mortality. So very, very important. You go through a ton of literature. What are the benefits associated with walking? Every study obviously is different, but let's break it down a little bit. Let's start from the top here. It can be good for joint pain. In some cases, it may play a role in reducing risk of cancer. Obviously, that's a very complicated topic. Somebody's dealing with a lot of fatigue, which we know folks with brain injuries frequently experience daytime fatigue. It's a great way to combat fatigue. Somebody dealing with low levels of self-confidence. Research has found engagement in regular walking can help boost self-esteem and confidence levels. What about type 2 diabetes? I do a lot of work in the area of diabetes. I have a certificate in diabetes, and walking is a great way to combat type 2 diabetes. Why is that the case? Well, it can play a very positive role in regulating blood sugar levels. It's great for bone health. It's great for heart health. It can reduce the risk of strokes. It's a great way to improve mental health, sleep health, and the list goes on and on and on here. So you don't have to start out by walking really fast. And again, talk to your doctor, but start out really, really slow if your doctor gives the approval. Just really slow. You build up to that. But low to moderate intensity walking has been shown to increase our aerobic capacity. It can have a very positive impact on our body mass index. So again, weight control can play a very positive role in blood pressure regulation and cholesterol issues. Hang on to these two. We're going to talk about them in more detail in a few minutes. This is good in general for all of us, but if you really want to preserve and enhance brain health, plenty of studies show the engagement in regular forms of walking is really, really good for our brains. Why is that the case? Well, it can help with blood flow. It's good for neuroplasticity. Dan and I have done some talks on neuroplasticity in the past. I'm sure all of you are familiar with executive function. We know that the majority of folks with a brain injury are dealing with some level of executive function impairment. Walking interventions can play a role in improving executive function capabilities, including processing speed, working memory, which is our brain's post-it note. We'll talk about these things in greater detail as well in a few minutes. I do a ton of work in the area of the gut-brain axis and psychogastroenterology. Why do you want to care about these topics when you're studying brain injuries? Because there's numerous studies that show one issue to take into account after a brain injury may be more digestive health issues. Why do you want to care about what's going on in the gut? Because of the gut-brain axis. If your gut is not working properly, that impacts brain health and vice versa because of the connection between our brain and gut. Exercise is great for improving gut health as well. So if you really want to enhance brain health, also develop an appreciation for ways to enhance gut health. So fit walking that was mentioned on the last slide, that's another form of walking. This is a little more intense kind of walking. So a person with a brain injury, it's definitely something to take into account with your healthcare provider. It may not be something that you would be able to do at first. Maybe it's building up to that, obviously under the supervision of a qualified exercise specialist as well. But fit walking, basically in a nutshell, is speed walking. And there are groups out there too where I've seen people do this. It's like, holy cow, how do they walk so fast? It seems like they're walking as fast as I run. So it's a very fast-paced walking. It really gets the heart rate going, and that's called fit walking. Another form of walking that you'll find in the literature is called Nordic walking. This is, from everything I've learned about walking over the years, this might be the kind of walking that generates the most full body benefits. I could be wrong on this, but Nordic walking is when you see people walking down the road, they have poles in their hand. Before I learned about walking, I always thought they used the poles for balance. And some people do, but Nordic walking, you're getting your upper body involved as well. So it's a better full body workout. Plus, it could be, I think, in my opinion, Dan, if you have any thoughts on this, it might be really good to consider in conjunction with your healthcare provider. Would Nordic walking, the use of hand poles, be really helpful for somebody with a brain injury, especially if they had mobility issues, to give them just a little extra support? Plus, it's also playing a role in enhancing upper body health as well. Interestingly, too, Nordic walking has been associated with improved neuroplasticity and neurological protection, which is great for all of us, especially somebody that sustained a brain injury at some point in their life. You dig into the Nordic walking literature, there are a multitude of benefits to take into account. In a nutshell, Nordic walking is safe in most cases. It helps improve stability. It burns more calories than standard walking. It's great for improved posture. Why do you want to care about posture? There's some really interesting research on body posture issues and poor mental health and poor brain health. So one practical intervention would be to really work with clients on improving body posture. It's great for reducing pressure on joints, and the list goes on and on and on. So Nordic walking, very, very good research on this as well. What about group walking? Maybe somebody's really struggling with motivation. Maybe they struggle with loneliness, isolation. Group walking can be another effective strategy. Lots of great benefits of going for walks with other people. The benefits are usually more enhanced when you're doing it in a group than doing it individually because it's going to enhance social health. Maybe you're laughing more, you're communicating more, it keeps you more motivated, and it really promotes more participation. And typically, it's pretty enjoyable for most people, according to what research has found. There's a lot of research out here. I wouldn't get hung up on this number per se, but I wanted to throw a couple studies out there. You don't need to be walking for long periods of time to generate benefits. This one study said even 12 minutes of walking can boost your mood. I've seen other studies that after dinner, go out for a 6 minute walk. That might be helpful. So it's not like you have to go out and walk for an hour a day or 45 minutes a day. If someone's really dealing with time restrictions, a very short walk can play a role in mood enhancement and brain health as well. Dan, I'll park the brakes there for a moment, open it up to any thoughts or questions that folks may have.
Yeah, I do.
Hey, Dennis.
Um, hey, thanks for this. I have a
Welcome.
yeah, my last PT I did put in a chat. She had me on the treadmill walk backwards too. But I had a question for her, and she waited a week and answered it the next week. So I have a stationary recumbent bike in the garage, and so I could either do the bike or the walking. And I asked her if I could only choose one, which one should I do? Um, and she did say the walking. Now my wife says I'm missing that she said I need to walk an hour. I don't remember that. Between the two, do you have any thoughts?
Like which one would be better, the stationary bike or walking?
Yeah,
I hate to give advice when like you're working with a really probably a great practitioner right now. I would really follow that person's advice because they're going to know you and your individual circumstance. But
yeah,
walking
and
again is
well,
great.
I finished with her a couple months ago, and I do have my brain injury cut my vision severely. So I don't know if that was part of it or not. Like me, looking around using my eyes as part of my, therapy or whatever.
And Dan, I know you'll probably have some thoughts on this because of our discussions about the stationary
Yeah,
bike,
yeah.
but my own humble opinion here, if somebody's dealing with some vision or mobility issues, in some cases, a stationary bike may be way safer. But again, see what the healthcare provider says. And Dan, maybe we can do a follow-up and just talk about the research on stationary bikes and brain injury too. But Dan, what are your thoughts?
In my experience, the stationary bike was like the my outlet, my escape for exercise, and I use that both for a break from the fatigue, the buildup of hitting my limit, and also it was just I could get really intense and put my music on, and so I loved the
Yeah,
stationary bike. But I think that let's do like a zoom out where I do think that both forms of exercise are excellent, and then if your medical practitioner or whoever you're consulting isn't there anymore or they're not listening, yeah, I think if a vision issue is there, you don't want to walk around in a way that could risk things or you might fall. So that
right,
another factor for you to consider. And Jerrod, maybe you have a thought. I think walking on a treadmill with your hands holding is a little bit less. It's less engaging of your balance and less engaging of other, I don't know, proprioceptive elements. I'm assuming or I'm guessing with that. So I think maybe the bike would be better, but I think both are good. And the safety issue needs to be factored in. Sometimes you're the
right.
one that has to decide that. We could talk about your vision issues. I think that what you're describing with the vision issues is a good example of brain injured people will have other kinds of problems, and so that needs to be factored in. But yeah, so sorry I don't have a really clear answer, but maybe
No,
walking where it's safe and then bike on days that you know you can't get out, like in who knows, snow,
yeah.
rain, or other issues. Yeah,
No, that's all fair. I didn't know if like she was encouraging me scanning these my eyes or on the bike I can get my heart rate up more for sure. And so I
I
didn't know.
agree. Yeah, yeah. Um,
I do
yeah.
know people that have gone to pool therapy who've had really great success where it's very contained and you're working your full body there too. And it's in conjunction with professionals who are typically in the pool with the individual. And that can be great for folks with vision impairments as well, or those mobility issues.
Thank
Yeah,
you.
oh yeah, thank you for sharing that. I really appreciate it.
Jerrod, I had a question about, you mentioned it in the Nordic walking, and maybe you'll get to this later, but do you know any specific literature on like the neurotrophic factor benefits that come from exercise, thus promoting
Mm,
plasticity and other brain benefits?
Yeah, I have many, many slides I've prepared that I had to cut on this, but brain-derived neurotropic factor is a big one as to why exercise is so good for brain health and mood. And
Yeah,
brain-derived neurotropic factor is a protein in the brain. There's all kinds of things that we can do to enhance that, including exercise. There's really cool literature on gardening intervention, so people getting outside and just having a garden and getting their hands in the dirt. Great for brain-derived neurotropic factor, laughing, just being around positive people. Definitely, that is an area I think we should look into, Dan, as well at some point, because that's a huge neuroscience topic with significant implications for brain and mood as well.
right. And I guess in that sense, walking is one of the many exercises. So, not to say like walking is better or worse, but yeah,
So clinical considerations, kind of how this might apply to brain injuries, maybe some other conditions as well. Just to kind of let's see what the literature says a little bit about this. This is a really nice study from 2025. And Dan, this ties into the brain-derived neurotropic factor and neuroplasticity, but walking is really good for our hippocampus as well, which is great for memory, big center of memory. Walking's good for all parts of the brain because it increases blood flow, it can reduce inflammation, it's great for synaptic connections in the brain and all that good stuff. Again, it gets challenging depending on the severity and location of the brain injury and all of those factors. But in a nutshell, research does say walking is phenomenal for brain health. Here is a really good study specific to brain injury. And I have many, many in here that I included today, and many, many more that I had to get rid of just because of time. But what you'll need to know is that there have been plenty of researchers around the world who have looked at traumatic brain injury and walking together from many, many angles. And pretty much the majority of these studies do indicate that walking in most cases is safe and effective for people with brain injuries. It's not going to be always, but this is one study that talked about a home-based walking kind of program to help people with a brain injury reduce stress and depression. Here's a little bit more about the brain injury literature, and this is more geared toward a mild traumatic brain injury, kind of concussion, those kind of things. But we want to be aware of potential barriers, things that may get in the way. It could be prolonged sedentary behavior, where we're going to talk about sedentary behavior today and how that really is a threat to human health. Maybe there's a fear factor. So after a brain injury, the person really developed a fear. And I hate to say this, maybe their brain injury was a result of going for a walk and maybe they got hit by a car. And I have had two clients in the past that I've worked with personally that have been on a walk and got hit by a car and sustained a brain injury. So we need to be aware of kind of that post-traumatic stress disorder factor there. Could walking be a major trauma? And that is another barrier we need to take into account. For some people, and Dennis, this ties into what you brought up, but this study looked at maybe the person didn't have access to specialized equipment, treadmills, stationary bikes. So maybe there's some financial factors there too. Maybe somebody lives in a group home, maybe they live in a small apartment. They just don't have the space or the resources for these things too. I'm going to do a talk for Dan on the field of lifestyle medicine and how that factors into all we're talking about. There's 6 pillars of lifestyle medicine. One of the pillars is exercise. Other pillars are going to be stress reduction, nutrition, and many more. But when we are thinking about brain injury, treatment, intervention, recovery from a brain injury, we need to also be aware of what other lifestyle factors could be getting in the way that may exacerbate some of the brain injury symptoms. Nutrition is one. So someone's drinking energy drinks all day long and eating fast food, that's not good at all. If somebody with a brain injury is dealing with a ton of stress, that's not good. If they're using drugs or alcohol or sugar or vaping or lots and lots of caffeine, not good. Maybe they're dealing with high blood pressure, high cholesterol levels. We'll talk about all that in December in great detail. But we need to look at lifestyle factors too. That's a very important component to intervention. All of you know this better than I do, but the symptoms of brain injury are many and varied. It depends on the severity level. We're not going to get into the weeds on like what is a brain injury. I think we all know that, but why is exercise so important as part of a holistic approach? Well, look at all the symptoms of brain injury that can result. We know headaches are very common, sleep issues, concentration problems, irritability. I mean, the list goes on. Exercise can make a huge difference on many, many of these things. I'm not saying it's going to cure it, but anytime I'm feeling irritable or just frustrated, and I don't have a brain injury, if I go for a walk, after that walk, I usually feel better every time. So another variable to take into account is deficits in gait. And this is where you really want to work with qualified providers to really assess this because this can really get in the way of starting exercise and can be a barrier. So maybe in some cases, if there's some gait issues, maybe the person starts out with pool therapy to build up strength, mobility, and even competence, and then moving into something else. But again, that physical therapist, exercise specialist is going to make those kind of recommendations. So here's another really good study that was published a few years ago, specific to brain injury and fatigue. A very, very high percentage of people with a brain injury deal with daytime fatigue. What is one intervention that can combat fatigue in folks with a brain injury? Walking. Many studies support this. When we think about fatigue after a brain injury, if you're interested in looking at this research in greater detail, I would just Google post-traumatic brain injury and fatigue. And it's really multifaceted. There's a lot of components going on here. There could be some metabolic issues. There could be blood flow issues in the brain. There could be psychological issues. Maybe it's a motivation issue, but motivation is really rooted in executive function impairments and metacognitive deficits. And it could be related to some dietary deficiencies in some cases as well. So when we're thinking about fatigue within the context of a brain injury, it's not simple. It's a big puzzle, and likely the person would do well, probably getting assessed from a nutritionist, a sleep specialist, a neurologist, and usually there's a lot of moving parts here. Just in case, I wanted to sneak this in because I do a lot of work in the area of mental health, and we know that a lot of people with a brain injury are also dealing with a co-occurring mental health condition. Depression, anxiety, there's many, many more. But there are numerous studies that show programs that support individuals who want to improve their mental health. Walking can be very, very effective. I'm putting together some other workshops for different groups on how do we implement walking into mental health and substance use treatment, because it's a no-brainer to me. And there is some research out there that says exercise and these kind of things can be really just as effective as certain medications for depression, anxiety. And I may get pushback on it, but that's kind of what the research says as well. And I'm not giving any advice on medications, but exercise really is a medicine. So again, another study kind of alluded to this before. If you want to improve depression among people with brain injuries, and if that person is cleared to go for walks, walking can be very, very effective. If somebody is dealing with a drug or alcohol problem, There are plenty of studies that really encourage providers and treatment programs that serve folks with substance use issues to really consider the benefits of exercise and walking and other kinds of things because it is a holistic approach that can play a major, major role in reducing cravings and relapse for a lot of people with substance use issues. So why does exercise help reduce addictive behavior? And this could be to food addictions and sugar and alcohol and drugs, and the list goes on. Well, Dan brought up the brain-derived neurotrophic factor. That's a factor. Exercise can help improve sleep. There's plenty of research that shows poor sleep is actually a driver for drug and alcohol relapse. I got lots of studies on that one. So drug and alcohol programs would do very well incorporating sleep improvement strategies. Helps people focus more, so they're more attentive in the group treatment setting. It helps them manage their cravings more effectively. It gives them structure, routine, and the list goes on and on and on. Before I get into the next section, any thoughts, questions?
I want to add a thought, and I think this is maybe this would be something we could do a seminar on in the future. But I think the fatigue aspect of brain injury is a critical aspect and highly drastically misunderstood. And in my experience, and I have a few examples that I've been able to collect through these talks, the brain having an injured brain and inability to do things leads to a fatigue on its own or because of the brain's inefficiency. And learning to not push the limit is something that is talked about, but having a way to sort of what's the word, regenerate, or basically using walking and using a little bit of activity and a break, which I used walking and the bike. It helps to like diminish that limit hitting. And so the fatigue aspect is directly connected with the brain injury, and then the walking can kind of prevent or decrease the level with which you hit the limit. So I think that that leads to the depression, or that leads to all the other factors, or at least is one of the underlying factors under the other factors. And I know it's all interwoven, but it's like just getting that regular walk before you hit the limit, I think can be of huge benefit. And in my experience, it was mainly the stationary bike, but walking as well.
Um,
So that's a more complex topic, but I just wanted to share that thought.
Yeah,
Fatigue is such a big topic. Go ahead, Dennis, please. Sorry.
if I could jump in, yeah, the I know it was under substance abuse, but still, it spoke to me the part on structure and routine, and Dan's last comment kind of spoke to that. I think for me, probably building up to the bike by walking, might be the better way for me.
Yeah, and then having that structure on a regular basis also becomes your escape because it's easy to push yourself to your limit and not realize, but if you set a clock or set a weight every 30 minute, every 45 minutes you go, just hit the bike or walk for
Right.
just a little bit of time. It's a huge benefit. I use that strategy and I know several people who have. It took me years to develop that strategy though.
Every 45, that sounds a lot. Eh.
Well, it was when I was in school, so during my homework and stuff
Oh,
like that,
sure.
it'd be about 3 hours of that. With every 45 minutes, I'd take that break.
Oh,
Not
yeah.
not literally every 45 minutes of the day. That would be too much.
Yeah.
Yeah, Dan, it would be great fatigue to do something on that. I have a lot of content on fatigue. There's a lot of dimensions of fatigue. And again, a lot of people with brain injury deal with fatigue. Cognitive fatigue is a real thing, like multitasking, not a good thing. That depletes us of our energy. Think of maybe you're meeting with somebody and they come in with a full tank of gas and you're sitting with a client. And if somebody has a brain injury, and I've seen this many, many times, they come in really present, alert, but within 10 minutes, I mean, they're like a different person. They're falling asleep. They can't stay focused. That is a sign that we're dealing with extreme cognitive fatigue. And what could be going on there if we really peel back the layers? If I put on my neuroscience hat right now, And if it's a brain injury, what could be going on? Could be blood sugar issues. Maybe that person came and met with you at 12 o'clock and you find out they didn't have breakfast that morning. They skipped breakfast. Could be a blood sugar issue. Maybe the client goes to their healthcare provider and gets a full physical workup and you find out vitamin D levels are low or iron levels are low, iron deficiency, all of that. There's a ton of literature on neuroinflammation in this stuff, blood-brain barrier stuff. Mitochondrial health is a huge factor when we're talking about fatigue. I do a lot of work in the area of the functional kind of world. Mitochondrial health is like the powerhouse cell in our body. It's really related to all kinds of stuff. Allostatic load would be a topic you want to be aware of, biological despair, the HPA axis. All of those things I'm throwing out at you is to kind of get us to think how complicated fatigue truly is and where we need more training on that. It's not as simple as the person didn't sleep well the last night. Maybe they slept great, but maybe there's something going on with their biochemistry or something in the body that maybe no healthcare providers really dug into, or maybe they don't know these things. So if you get it properly assessed, then you can properly treat it and it can help with improved energy and focus and follow through and all kinds of good stuff.
Yeah, this is a massive topic, and thanks for listing all those factors. And then there's also the biochemical because the brain has been injured, the mitochondria dysfunction because the brain has been injured, and other factors to consider. So yeah, we could definitely talk about this. I have a lot of thoughts.
Yeah,
We
yeah.
get
No,
into that.
appreciate it.
Yeah.
How do you start thinking about this in practice again? Talk to your healthcare provider. But it's a really practical solution in most cases to common barriers people face about wanting to engage in regular physical activity most of the time, not always. So when we think about walking, it does get a little more complicated when we're thinking about a brain injury and neurological impairments. And this slide here gives us some things to think about why it could be a little more tricky. So when you're working with a healthcare provider or an exercise specialist, make sure they really understand brain injury because a lot of those folks may not truly understand brain injury. So a couple things we need to be aware of. Balance issues, could be attention issues. Folks with a brain injury may look like they have ADHD. Maybe it's not, but they have a really hard time focusing. And if you're walking outside, and I do suspect, remember those two cases I mentioned where they got hit by a car? I didn't tell you what they're diagnosed with. Each of those clients is diagnosed with fetal alcohol spectrum disorder, which is prenatal alcohol exposure. They had profound attentional deficits, depth perception issues. They misjudged distance. They walked across the street looking both ways. Because of their depth perception, they didn't realize how close that car was to them. They got smacked by the car. A lot of things to consider. Endurance. This could be a safety issue. Maybe somebody with a brain injury is so motivated to go out and walk, but they underestimate their energy level. So they go out, they walk too far away from their house. They get halfway from their house and now they're just exhausted. And now they can't walk back. They're stuck there because they're just so drained. And so safety considerations we need to take into account here as well. This is where exercise prescription falls into place. In that graduate certificate I did, we learned about this over and over and over again. But anytime somebody wants to develop an exercise plan, again, work with your qualified specialist. But these are some of the things you'd want to be aware of. The frequency of walking, the duration, the intensity, the length of the intervention, exposure time. It's very complicated. So you need to make sure you have qualified providers who really understand these things and really develop that plan for that individual. We also, if I put on my behavioral health lens right now, a lot of emotional and behavioral health factors we need to consider when we're working with clinical populations. Maybe the client with the brain injury, again, is dealing with a ton of depression, anxiety. Maybe it's full-blown post-traumatic stress disorder, which is more common among some people with a brain injury. Maybe there's some early attachment patterns, some adverse childhood experiences. Alexithymia, I did a talk on this for Dan, I think last year, if I remember right. This is emotional blindness. 50 to 65% of people with a brain injury are dealing with alexithymia. The more these emotional health concerns are going on, those are other factors and barriers we need to consider. If your client or you is living the modern lifestyle, it's really not that healthy if we're being brutally honest with us. The way most Americans live today, we're on the screen longer, we're not eating healthy, we're dealing with more stress, more people are on the go, and they may skip meals. So the more people are doing these things, and we're all guilty of this probably on some level, the more people are dealing with this, it's not good for their brain and body. And this is absolutely detrimental for some people with a brain injury because they may have more kind of metabolic imbalances in their body that they really need to keep regulated. So just be aware of these kind of things. The more of these things going on, these are good target areas to maybe look at our lifestyle habits and make some adjustments when appropriate. Been given more talks in the biopsychosocial model. Just gave a couple talks 2 weeks ago to two different groups. And in an ideal world, the brain injury field would absolutely use this model. It's just a holistic model. You're taking into account biological factors, psychological, social factors. So we're looking at nutrition, exercise, sleep. Does the person use chemicals? What's going on with their emotional health? Just a very nice, holistic approach. So in a nutshell, the biopsychosocial model, we're going to take into account many, many things. And we know human beings are complicated. So the more we can understand the complexities that that person is dealing with, the better off we are on developing an individualized, holistic, and integrative and multidisciplinary informed goal plan that can help that client reach their goals and hopefully improve overall health and well-being. Just in case you haven't heard of this, I just want to introduce you to this. It's called the Life's Essential 8. You can go on the American Heart Association's website and find it. It's just very common sense. But the Life's Essential 8 is really talking about helping people in general eat better, maintain a healthy weight, get more exercise, stop smoking, managing your blood sugar levels. It's all very good for our cardiovascular health. And what's good for our heart health is good for our brain health. It's good for our gut health. So it's called the Life Essential 8. It's just a very nice, helpful framework that if all of us tried to live by, I think we would just be way healthier in general. Many barriers out there again. This is in general, not specific to brain injury. So if we throw in those things we talked about today with brain injury, it gets a little more tricky and challenging. But work schedules could be a factor in some cases. What about lack of self-efficacy? This is something that comes up in the brain injury intervention literature where it says if you're working with folks with a brain injury, be aware that their self-efficacy levels could be lower in some cases. So we really want to target that with intervention. Traffic considerations. Maybe somebody works all day and they want to go out for night walks. Well, nothing wrong with that. However, maybe the person has a brain injury and going out at night is a little more tricky and a little more dangerous for a variety of reasons, including maybe they have difficulty with sight and they need that daytime light to really see things. What is going on in the neighborhood? Here's another factor maybe we don't think about. Somebody wants to go for walks, but maybe they live in a neighborhood where there's a lot of challenges, stressors, and going outside can be maybe a little tricky, dangerous in some cases. So we need to look at neighborhood factors. Lots of neighborhood factors. Here's a good article that I usually cite when I talk about this, but just what's going on in the neighborhood is another factor. Neighborhood, social environments, and poor health outcomes. So if that person lives in a neighborhood environment, they don't go out a lot. They may be dealing with more social isolation issues. Could they have conflict with neighbors and that prevents them from going out? Do they have a fear of just leaving their house? So neighborhood dynamics, big factor. If I put on my forensic hat right now, I do a lot of work in the area of forensics and criminal justice topics and do a lot of teaching in that area. Crime is another big variable to take into account. So maybe part of that neighborhood factor is they want to go outside, but they live in a neighborhood environment where maybe there's gang activity, maybe there's conflict with law enforcement, maybe there just a lot of not good things going on in that neighborhood. And crime is a big factor that gets in the way of people going out to exercise. Sedentary behaviors are a threat to human health. I have articles that I sometimes cite that do indicate, and I don't know if I believe this always, but there's some articles that I have that say prolonged and chronic sedentary behaviors. So this is people that sit all day long, many days in a row, weeks, months. That could have almost the same effect as smoking a lot of cigarettes on the human body every day. So get moving more as much as possible. Here's some activities, screening considerations that really point to the fact that we need to screen for this more frequently. And television viewing is a big factor. There's a case I consulted on a while back. The person had a brain injury. She was chronically overweight. She had a lot of trauma in her history, a lot of fear. She sat and watched TV and on her gadgets probably 14 to 16 hours a day. And then the rest of the time she was sleeping. The only time she got up was to go to the bathroom and get something to eat, but she was in bed almost all the time. And unfortunately, this led to many issues. Hospitalizations, kidney stones, joint pain, headaches, the list goes on. What are the causes for prolonged sedentary behaviors? Again, fear, mobility issues. Look at some of the COVID-19 literature that's been published in the past few years. COVID-19, the lockdowns was a huge factor. Traffic congestion, many things. And why do we want to care about prolonged sedentary behaviors? Well, over time, lots of studies show it jacks up oxidative stress. That's another reason why exercise is so good because it reduces oxidative stress. Prolonged sedentary behaviors year after year may increase the risk of osteoporosis, certain kinds of cancer, colon cancer, breast cancer, prostate cancer. We have research on all these things. It may increase the risk of type 2 diabetes, obesity, immune system dysfunction, mental health issues, the list goes on. Chronic sedentary behaviors is not good for executive function. Executive function is the CEO of the brain. That's related to decision making, problem solving, reasoning, time management, organization, goal planning. If you're a provider listening to this and you really want to start implementing this, maybe you work with providers and you want to say, hey, let's get some walking interventions going. Let's get some more training on this. We'll have the right training, the right credentials. And if you were to develop a risk assessment protocol when you have a client that comes to you and that client really wants to start walking, what would a risk assessment look like on how we can reduce and minimize issues with walking? Nothing's 100%, but we want to be aware of these factors and many more. Walking with a dog sounds great, but what happens if the person's walking a dog? And I have a loved one where this happened to. She loves going for walks. Her dog's crazy, beautiful dog, but the dog, anytime another dog walks by, just yanks her. Yanked her so hard, she fell to the ground and pulled out her back. So you want to be aware of that. Weather conditions, walking on roads that are a little icy or wet, not good. What about livestock? Maybe someone lives in a rural area and just being aware that there could be a lot of animals out there. Air pollution, the terrain, maybe they live in an area where the sidewalks are really bumpy. I live in a neighborhood that the sidewalks, I don't think have been replaced in 20, 30 years. It's very bumpy. And I can't imagine if someone has mobility or vision issues, they could easily trip and get hurt. So these are a few things to consider when we're talking about reducing the risk of starting to go out and walk. Therapists, we got any counselors here, social workers, case managers, again, whole line of literature on walking therapy. But if you wanted to really start integrating this into therapy, and again, you got to have the right training, all that good stuff. These are some things you'd want to consider here. Maybe it's partnering with exercise specialists. Maybe it's getting a couple certifications in these areas. But the benefits are amazing. If you do talk therapy and you're sitting in an office face to face and you were start to infuse walking therapy into the good work you're doing, you're going for walks with clients, that likely leads to even better benefits, the research says. Dan, I think I'm going to push through this for time and then stop at the end for questions, thoughts.
Great.
So, holistic health. I'm a big fan of holistic approaches. I just think it's a no-brainer because humans are complicated. I'm not trying to put down any one size fits all program. So if you work for a treatment program and it's a one size fits all approach and every client that comes to you, they go through the same routine. Those programs are not that effective, the research shows. Individualize our approaches to that client's strengths, needs, limitations, unique circumstances. Holistic health takes that into account. How do we want to support brain health? It's good for all of us. Exercise, eat good, take more naps during the day, rest as well. Maybe you're not falling asleep, but I have friends that do therapy. I don't know how they do it. Some of them do like 9 sessions a day, back to back to back to back, and they have like 3 minutes to have lunch. They burn themselves out. I see it all the time. Slow down if possible. I'm guilty as charged too. Learn new things, be curious, promote optimism, reduce your stress, be around healthy people. These are all good for brain. This is good for brain health. Cognitive decline. There's plenty of research that shows that maybe brain injuries, especially people that have had more brain injuries, multiple head injuries over a long period of time, and they haven't had a lot of support and services, it may contribute to more neurocognitive decline as we get older. What are the factors involved in cognitive decline? So more like Alzheimer's, dementia, Parkinson's, things like that. Lifestyle factors, big factor. Genetics obviously is a factor as well. We'll talk about this in December, but lifestyle medicine, I have certification in lifestyle medicine. I love it. It's a no-brainer approach to me. It's just so common sense. Who wouldn't benefit from eating healthier, getting better sleep, reducing stress, being around positive people? Lifestyle medicine is a holistic approach that borrows from nutrition science, positive psychology, behavior change, sleep medicine, exercise physiology, addiction, health and wellness coaching. Lifestyle medicine is a holistic approach to health. It's focusing on coaching, self-care, education. It's preventative in nature. It's a whole person care approach. Lifestyle medicine first started out years ago just for medical doctors. But since that time, there's been countless studies showing that the application of lifestyle medicine can easily be applied to mental health, chemical health, the criminal justice system, the list goes on. And again, we'll talk in depthly about lifestyle medicine in December when I do that talk for Dan, but these are the 6 pillars of lifestyle medicine again. Physical activity, good sleep, good eating, avoiding harmful chemicals, drugs, alcohol, tobacco. I'd even add avoiding lots and lots of sugar and avoiding lots and lots of caffeine. That's not good for our brain and body. And managing our stress more effectively. So if you design a walking intervention, again, you have the right credentials, you're working with the qualified folks. We want to be aware of the dose of the walking, the duration of the program, the context in which the walking intervention is going to be applied, and then the format. And again, I want to get hung up on the numbers, but we hear about this a lot in like the media and you read things online. How many daily steps does someone really, really need to benefit health? I think we've all heard about like 10,000 steps a day is the go-to. If you look at that research, somebody, I don't know who coined that, but it just was thrown out there one day, and I think the media globbed onto it, and that kind of stuck. 10,000 steps a day. That's not a bad thing. But available data, if you really look at the data, 4,000 to 18,000 steps, somewhere within there, likely generates some good health benefits. So everybody's different. How do we incorporate physical activity into our day-to-day lives if that person is cleared to do this? Well, there's all kinds of things to be aware of. Get moving more. Get outside. Take the stairs over the elevator if you can do that. Obviously, I'm not saying do that if it's going to create more struggles and hassles. Maybe you work at a job and you're sitting all day long. Could you get a station where you're standing more or even a walking treadmill? Go for walks and maybe do your phone calls rather than sitting. Garden. Take a cooking class, get a volunteer job. I mean, there's so many things we can do to kind of get moving more. It's kind of more for kind of the therapist out there, counselor, coach, but walk and talk therapy, tons and tons of research shows it likely leads to better outcomes than just sitting with a client face to face in an office. I'm not saying that's a bad thing if you're just doing that with face to face. That's how most therapy's done. But the walking and talking therapy, according to the research, every study's different. There's limitations, but it may play even a greater role in helping your client reduce stress, reduce rumination. It may help clear their mind more and bring down body tension. I give a lot of talks on neurocounseling. That's the infusion of neuroscience into counseling practice. And in that research literature, it talks about therapeutic lifestyle changes. Therapeutic lifestyle changes seem very similar to lifestyle medicine. There's a little difference in there, but a therapist who has training in therapeutic lifestyle changes is really infusing the principles of exercise and nutrition and stress management and positive recreation into the good work they're doing. Why is walk and talk therapy maybe better? It helps increase blood flow to the brain. So if your client has better blood flow going on to their brain, when you're teaching them a skill, you're doing therapy while walking, their brain is able to take in that information more effectively, make sense of it better, and retain it into their brain because of maybe some increased blood flow. Here's a case I consulted on a while ago where the client, I worked with the group home, the client and their team got the clear from the doctor and they started going for regular walks with this client. And this client reported after doing this over and over again for several days, anxiety was better. They seemed more clear. They were less angry. They were able to get their emotions out better. This is just one case of many, but it's good. I don't see many downsides to this. Here's the HPA axis. I briefly mentioned that before about the fatigue. So there's plenty of research that shows folks with a brain injury are going to be dealing with HPA axis dysfunction probably. The H is the hypothalamus, the P is the pituitary, and the A is the adrenal axis. This is our body's main stress response system. This is our hormone regulator. This has a lot to do with cortisol. Most people with mental illness diagnoses, most people with drug and alcohol problems, most people with chronic health conditions are dealing with dysfunction in the HPA axis. If this axis is off, it impacts mood, energy, our sleep, our metabolism. This axis is also part of the gut-brain axis. So if this axis is off, it impacts our gut health in a lot of cases too. It's a huge topic. I've given many, many talks on this. So maybe you're asking yourself, you live in a rural area, you don't have good transportation. don't have access to qualified providers. Plenty of studies show that the use of telehealth approaches can be very effective as well. And this is a good study that was published in 2022 that showed that the client with the concussion, who was an adult, they worked with telehealth providers, and those telehealth providers were implementing progressive walking interventions, and they weren't doing it face to face, they were doing it remotely. And this is an 8-week walking intervention that showed some good benefits for that person who had a concussion. Here's another study that was just published this year in 2025 in the brain injury literature. And this study looked at the use of a peer-based walking group program. So basically, it was a group of folks who all had brain injuries, and it was peer-led. And great benefits resulted from that as well. So doing that with other peers who are also experiencing the impact of a brain injury. Here's a little bit more about the neuroplasticity that Dan mentioned before. You want to strengthen neuroplasticity? Walking is a great way to do that because it helps improve our hippocampus, the brain-derived neurotropic factor, blood flow, synaptic connections. If you're interested in neuroplasticity, I'd recommend checking out the episode I did do on this topic with Dan several months ago. Just living a healthy lifestyle is great for neuroplasticity. Why do you want to care about neuroplasticity? Because it really goes to the heart of learning and interventions. It can help improve functioning for all of us. And if we can enhance neuroplasticity, what does it say? Improve decision making. It can help improve our problem solving. It's good for our memory. It's good for our mental health. And the list goes on and on and on. Anybody dealing with anger control issues, maybe people are running a domestic violence group or a court-ordered anger management group, or maybe you're just somebody who's really, really irritable and angry all the time. Well, there's good literature out there too that walking is good to help reduce anger. Maybe someone deals with sugar cravings, very common in our country. I can't count how many cases I've consulted on where that person loves their sugar sweetened beverages, loves their snacks. Walking is a great way to reduce sugar cravings. This one study showed that just a 15-minute walk at moderate intensity played a role in reducing sugar cravings.
I want to add with both those examples, the anger and sugar as an outlet or as an emotional escape. I think many people with a brain injury get angry at life because of the things that are not happening the way you want because of your brain injury. So that kind of becomes a way to manage those emotions that come from the brain injury problems.
Yeah, great point, Dan. And I know we're just a bit over on time, folks. We'll wrap up in just a minute. I'm not a nutritionist, I'm not a dietitian, but I have a master's degree in nutrition and I am currently being supervised by a licensed nutritionist. My goal will be, once I have all my hours in and pass the national exam and a few other hurdles, to become a licensed nutritionist. And what I'm hoping to do is to take all the knowledge I've learned over the years on brain injury and maybe develop some specific nutrition intervention programs for folks with brain injuries. It gets really, really complicated when we're talking about nutrition counseling and brain injuries. But there's plenty of research that shows that a nutritionist and dietitian should be at the table of all the other providers involved in the care of somebody with a brain injury. Getting out in nature is very therapeutic. Green space exposure literature, basically helping clients get out in nature more, is so good for our brains and body. Very, very good for mental health, emotional health, behavioral health, and cognitive health. Here's some of the benefits associated with green space exposure. It reduces stress, depression, anxiety. How do you feel when you are going out in nature, walking in the woods, compared to walking where there's all kinds of noisy traffic? I know I feel better. Outdoor walking during trauma therapy. So anybody doing trauma treatment, maybe someone with a brain injury is dealing with a lot of trauma or post-traumatic stress disorder. Some good literature shows that therapists who are trauma specialists who do outdoor walking with their clients may lead to better outcomes. Nature walking groups, great for mental health. Again, we don't have to do this individually. Walking groups, good research on it. Typically, it's safe in most cases, and it can help promote well-being. How do we reduce sedentary behavior? Well, here's some things you'd want to consider. Again, I'll send my slides to Dan. Do it with other people. Set realistic goals. Get education about sedentary behaviors. The more you learn about the health effects of sedentary behaviors, at least you're in a better position to know about it and then do something about it. Here's some interventions that can reduce sedentary behaviors on a deeper level. Again, I'll give my slides to Dan. Self-compassion, another practical intervention we don't think about. Teaching clients how to be nice to themselves has been linked with eating healthier, having more motivation to exercise. Anybody trying to quit smoking, self-compassion interventions may be helpful. Anybody struggling with emotional management, self-compassion can be very, very helpful. Equally important if we have professionals listening to this as well. Maybe it's starting a program in your organization because exercise programs within an organizational based setting can reduce burnout. It's very, very good for the entire organization. You don't have to be a therapist to do this. Maybe you're a coach, a mentor, a teacher. Plenty of research shows coaching interventions can be great around walking and talking and burnout reduction. Maybe you're working with parents and they're dealing with parental burnout. Walking interventions may help reduce parental burnout. Here's a really cool link that I came across. If you're looking for some famous quotes about walking, this is a really nice link that talks about famous quotes on the use of walking to improve well-being. Here's my email. Reach out again. I'll send my slides to Dan. Hopefully this was a little helpful. I'll stick around if anybody's got any thoughts, questions, concerns.
Thank you, Jared. I have a lot of thoughts, but I'm gonna use it maybe for something in the future with focusing some of these things to brain injury problem specific. The examples that I can think of come from the talk series and my podcast because I've talked to a lot of different people about different problems.
Well, is Jared still there? I'm
Yes, Sam?
okay. So, um, it was a great presentation. It was hard for me to listen to because I have so many barriers to walking. And in a nutshell, I'm in state housing now for my brain injury. I'm on a hill. I'm ambulatory wheelchair. I'm near a freeway. There's been gunplay in the neighborhood because of where I live in Seattle. Well, it's probably all over Seattle these days. So there's a lot of barriers to me even attempting to get outside, even in my wheelchair. So for someone like me, then I also have every time I eat, I fall asleep since my injury because apparently my body goes into it gave me dysautonomia, but my body goes into rest and digest every time I eat anything, no matter how much I eat or when I eat or anything. So the only thing I can come up with is that I need to figure out an exercise plan that I can do in my home. And then I have attention and executive function and short-term memory issues. So getting anything to be consistent or even happen is also a barrier. So I don't know what to do. And I know a lot of I know about the outcomes because I used to be super physical. I worked with children. I ran around with infant twins and ran up hills and strollers with them. And so my position for 15 years, the last 15 years prior to this injury, was very physical, was outside nature, was very demanding. Any advice?
Oh, I am so sorry. So much going on. And
Yeah.
I definitely don't want this to be triggering to anybody, but I know it probably is, obviously. And one thing I can think of, there was a case I consulted on She dealt with a lot of mobility issues, lived in maybe a similar housing environment, and her team got her into chair yoga. That seemed to be helpful to start out with. They
Yeah.
really dug into the health aspects of this. And I'm sure you did this, but just really working with the healthcare providers, getting a full metabolic panel, looking at root cause things going on that could be off biochemically to
Hmm.
maybe start correcting that with nutrition in some cases. And maybe that would help with a few other things. Heated pool therapy has been helpful for two people I know in situations like this where you're in a nice, heated, controlled pool environment with qualified professionals. So have you looked at any of those things or has that been helpful?
I've done well. I attempted because I hadn't gotten PT or OT a couple of years ago. Hadn't got it. There's a wait list and all the insurance and all the hassle, so things go by for a year, 2 years before you actually get access to some of these things. I did at one point on my own attempt to do senior yoga with 80-year-olds, and I ended up collapsing halfway through. So, but that was 2 years ago, and I'm hoping a little stronger now. Dan's aware of my situation. My brain injury, if I go beyond the limit of my um, energy usage, I literally physically collapse. My brain just shuts down like a car running out of gas, and it just shuts everything down, whether I want to or not. So I have to be
How much
very.
of that's hypoglycemia going on too? And that's another reason work with the
I have
healthcare
no
provider.
idea. I can't get anybody to. I've seen so many specialists within my network, and I can't get anybody to work as a team. Everybody's specialized, and then I plateau in whatever area they do, and there's no team effort, no holistic effort. And I'm trying to figure out, I just can't seem to get, and I don't have a support, and I don't have a brain injury that I can remember longer than 10 minutes from day to day. I live in little slivers of life. So trying to create anything that's a pattern is next to impossible, even with all the different um, interventions I've tried. I've put post-it notes. I've put calendars up. Everything becomes background. I've tried to have people, when I do have an aide, I haven't had an aide in 8 months, and I'm now doubled to 30 hours a week of help I'm supposed to be having, and don't have an aide. So kind of on my own. And I open my pantry door, and there's all my exercises, but my brain doesn't click. Oh, I need to do those. Like, I mean, it's comical at this point. At least I don't cry anymore. At least I laugh about it. But um sorry. So I can't get anybody to actually do a holistic thing or direct me in the right direction. I've seen ophthalmologists, I've seen speech therapists, I've seen OT, I've seen PT at home and into traumatic brain injury rehabs inpatient. That's where I learned pacing. That was the only thing that stopped me from collapsing every single day. I think the last time I collapsed was 4 months ago, but then I also don't do anything.
What you're describing is sadly a good example of the nature of brain injury problems, how they interact, and then many
Yeah.
people, some people here don't have outside support, and when you don't have outside support, it's a different can of worms. As a
Yeah.
person who had outside support, I can relate with the interconnecting brain injury spirals that can really, it's hard to explain, but you're explaining it, and then without support, it's like a different bag. So,
I just did want to say, while hypoglycemia is a typical theory, my sense as a dietitian is that's not, and a brain injured person, that it's something different.
yeah,
That's just,
it's a brain injury factor, and I don't see it in
yeah.
the literature. I appreciate what Jerrod presents too, because it's like this is what the outside world knows about, and I still think that we're in the cracks. Rachel, thank you, Holly. Rachel, do you have a
Yeah.
question?
Yeah, two things. I get the same thing that you described about your brain just shuts down, and it does almost seem like a hypoglycemic because I can't form words like I need, it's exactly what you're describing, but this would be very interesting to find out really what it is. So that was just kind of,
Yeah, that's what I am talking about the fatigue with brain injury, and I have collected evidence to show how it is different from other
mm,
factors. And the problem with it is that it could be the factors that Jerrod described, but with brain injury, I believe it's a specific. I keep trying to word it, but I do believe it's a specific condition, and the progression out of it also has a track, also has a nature to it that I have. It's like I'm collecting evidence to show that this is something unique. So yeah,
Great.
100%, 100%. It's the
Great.
specific to brain injury, absolutely.
Yes, because I never had this before, brain injury. And what she described was exactly what's going on too with me, and I'm sure other people. It would be wonderful, yeah, to, when you have more information to like, you know, go into that further. And the other thing was, I know, Jared, you'd mentioned about the nutrition, like nutrition specifically for brain injury, which, yes, we all have brain injury. We all could present similar, a little bit different, of course, because each brain injury is different, but then we have overlapping things. But it would be very nice to learn down the road. Like, I mean, I've worked with holistic people, and yeah, I eat organic and I do all, try to do all, the non-inflammatory and this and that. But having a brain injury just almost, it does feel like it's a little different than the standard person that sort of needs to reduce their inflammation and needs to get healthy. So I wonder if that's a whole nother sector of our brain injury and nutrition compared to just kind of the typical person.
There's so many nuances with that. Been spending a lot of time going through all the nutrition and traumatic brain injury articles. There's a lot. And even after going through hundreds of them, I still don't feel comfortable giving a training quite yet. But I
Yeah.
am putting one together because I want to make sure we understand those nuances, because what are those nuances we need to be aware of? Well, autonomic nervous system dysfunction, HPA axis, the gut
Yeah.
brain axis, how does that all factor in here? What part of the brain was damaged? What severity level was it? Was it somebody that had multiple mild head injuries over and over and over again? So, too many nuances, but the
Yes.
diet, I think we all know that the Western diet and fast food consumption, energy drinks, sugar sweet beverages is not good for anybody. I think that's safe to say.
Yeah. Thank you.
Rachel, I am of the same book. As a brain injury person, I'm still looking for the best explanation for what's out. For what I dealt with, I haven't found it. So I agree with you. And yeah, I think we got to figure out a way to talk about this in the future, maybe through the fatigue or something else, a topic that we could really focus on. But anyway, yeah, sorry. The brain injury
Dan,
part.
thank you for having me. I got to rock and roll, but thank you, everyone. Please, you got my email.
Sure.
Reach out if you have questions.
Thank you very much, Jer.
Bye, guys. Thank you.